Okay, so now we are going to work our way through some more of the glands that deal with the endocrine system. So the first one is the thyroid gland, and this gland is located below the larynx. There are two lobes connected by the anterior isthmus. So here is a picture of it. It is basically in your throat. Thyroxine, which is T4, and T3 are secreted by the thyroid. Iodine is necessary for production in the thyroid. The functions are, it can increase your metabolic rate, it promotes protein synthesis, and it enhances neuron function. Those are the three main functions. If you do not have the right levels of T3 or T4, your thyroid is not working correctly, and a lot of people have problems with their thyroid, and they have to take medication. If your thyroid is low, you may feel very lethargic, you may be tired, and that a lot of times is how people know that they have a problem with their thyroid, because they start feeling very tired and they just don't feel like themselves, and they get their thyroid checked, and sure enough, there's a problem with the secretions. If it's very, very low, you can actually have impairment mentally and physically, and even have some problems with growth and development, especially if it's for a long amount of time. Secretion is stimulated by TSH, which is one of the hormones we talked about in the last lecture, thyroid stimulating hormone. If you have hypersecretion, meaning too much T4 and T3, you could have an exophthalmic goiter, which is also called Graves' disease. And this is an autoimmune disorder that results in excessive TSH being produced. And this means that your symptoms could be, you could have restlessness, increased metabolic rate with weight loss, or bulging eyes due to tissue swelling. So this is the opposite, right? If you don't have enough being produced, you feel sluggish. If you have too much, you're actually like almost hyper. You could also have a simple goiter, and a simple goiter is an enlargement of the thyroid gland due to an iodine deficiency. So if you don't have enough iodine in your diet, then your thyroid hormones aren't being produced. They can't be produced correctly. If you ever look at, Morton salt on the label, it's like a little girl with an umbrella, and it says iodinized. They put iodine in salt to make sure that people get enough iodine in their diet to prevent goiter. So basically your thyroid enlarges in an attempt to make more hormones. It realizes, I'm not functioning correctly. I better enlarge to hopefully make up for this lack of hormones that I'm producing. But that doesn't work. That's not the answer. And this can be prevented by adding iodine to our diet, which is what I just mentioned with the salt. Okay, creatinism is a severe deficiency of T4 or T3 when a person is an infant, in infancy. And this can cause severe mental or physical retardation. It can cause stunted growth, abnormal bone formation, mental retardation, or sluggishness. Myxedema is a severe T4 or T3 deficiency in adults. And this can create symptoms of sluggishness, weight gain, weakness, dry skin, and facial puffiness. We also have a hormone called calcitonin, and this is also produced by the thyroid gland. And calcitonin deals with your calcium blood levels. It lowers blood calcium by stimulating calcium deposition by osteoblasts in bones. So osteoblasts are the cells in your bones that make bone. Osteoclasts, if you remember, are the cells that break down bone. So depending on the amount of calcium that you have in your blood, calcitonin will either stimulate bone to be broken down or bone to be formed. So basically you can take calcium out of the blood to make bone if there's too much, or you can break down bone to put calcium back in the blood if there's not enough. Then we have a parathyroid gland. And these are, on this picture you can see here, they are two little glands that sit on the thyroid gland. So we're still in the throat, and they are just little ones. There's two on each side, and they sit on the thyroid gland. They are on the posterior surface of the thyroid gland, here it says. Two glands on each lobe. So they secrete parathyroid hormone, PTH, and this deals with the increase of the concentration of blood calcium levels in three ways. So this is how it works. One, it promotes calcium removal from bones by osteoclasts and inhibits calcium deposition by osteoblasts, which is kind of what I just described, and it inhibits excretion of calcium by the kidneys. And thirdly, it promotes calcium absorption into blood by the intestine. So all three of these systems are working to keep the blood calcium level correct. If you have a problem with your parathyroid hormone, this is what may happen. One of the disorders is if you have a hypoparathyroidism. Hypo, not enough. It causes a severe drop in the blood calcium levels. This can impair someone neurally or muscularly because we need calcium for our muscles to contract. If you remember that part of muscles, right? We need calcium to have our muscles literally contract when remember the actin and the myosin come together and cause the cross bridge. So literally we need calcium for muscle and for our nerves to work properly. If you don't have enough blood calcium level, it can cause a heart attack, cardiac arrest, and sudden death, and a tetanic contraction of skeletal muscles that may cause breathing to cease. So basically tetanus of a muscle, which would be like increased stimulation and no relaxation, and this obviously could cause you to stop breathing. Hyperparathyroidism, too much, is caused when there's too much calcium to be removed from bones and abnormally high blood calcium levels. And if there's too much calcium being pulled out of your bones, it would obviously cause soft or weak bones, and then you'd be prone to fractures or breaks because your bones literally wouldn't be strong enough. Excess calcium can lead to kidney stones or deposits elsewhere in the body as well. Okay, then we have the adrenal glands, and they sit on your kidneys. And they are broken into basically two parts: the cortex, which is the core, and the medulla, which is the middle. And that is shown here in this picture. So you have 2 adrenal glands, 1 on each kidney, so you have 1 on each side, and as I mentioned, they have 2 portions, the inner adrenal medulla and the outer adrenal cortex. Hormones of the adrenal medulla, the inside part, are epinephrine and norepinephrine. And these are regulated by your sympathetic division of the autonomic nervous system. And they are secreted during times of stress. Some of the effects of these hormones can be a decrease in blood flow to viscera and skin, an increase in blood flow to skeletal muscles, lungs, and nervous systems, an increase in blood glucose levels, and an increased rate of cellular respiration. So think about those last 3 things. If you are in a stressful situation, maybe you have to run away. You want more blood flow to go to your muscles, to your lungs. You want to increase your cellular respiration. You want to be making more energy. You want to run away. And this is what this is talking about. The hormones of the adrenal cortex, remember that's the outer layer, is aldosterone. And this is a mineral corticoid. And the functions are that it regulates electrolyte concentration in the body fluids, and it maintains blood volume and blood pressure. It can cause kidneys to retain sodium and excrete potassium. It can cause water to be reabsorbed through osmosis. And the secretion is stimulated by when there is a decrease in sodium or an increase in potassium or a decrease in blood pressure. It would cause this to kick in and to try to regulate your blood volume and blood pressure. Cortisol. This is a secretion caused by the ACTH stimulation, which we've talked about. And glucocorticoids exert negative feedback control on ACTH. This then maintains the blood glucose levels by changing non-carbohydrates into glucose. It responds to stress by making more glucose available to body cells. And it reduces inflammation through immune reactions. Androgens. These are male sex hormones, and they play a role in the development of male sex organs, usually in adolescence, which is why it says it has more of a minor effect in adults, because adults already have their sex organs. It also causes women to have sex drives, and an overproduction in both sexes causes exaggerated male characterizations. Some disorders, if you have hyposecretion of the adrenal cortex, there's something called Cushing's syndrome. And sometimes this happens due to tumors in the cortex or an excess amount of ACTH being made. Symptoms are high blood pressure, high blood glucose level, protein loss, osteoporosis, fat accumulation on the trunk of the body, fatigue, edema, decreased immune system, and a full round face, because you're kind of everything just isn't working right. So you're just you have high blood pressure, so you're almost there's just too much. There's also something called Addison's disease. And this is due to a severe hyposecretion by the adrenal cortex. This results in low blood pressure, low blood glucose sodium, an increase in blood potassium, dehydration, muscle weakness, increased skin pigmentation, and if it's not caught without treatment, death can occur very quickly. Then we have the pancreas. This is an elongated organ posterior to the stomach. It functions as an exocrine organ. It secretes digestive enzymes, and they are carried by the pancreatic duct into the small intestine. It also has endocrine functions. And these are the islets of Langerhans that secrete 3 hormones. They are glucagon, insulin, and somatostatin. Glucagon increases blood glucose concentration when it drops too low, even when carbohydrates are depleted. It causes the liver to convert glycogen to glucose. It helps convert non-carbohydrates to glucose. So it increases blood glucose concentration. Blood glucose controls secretion by negative feedback. When you have a low blood glucose, it stimulates secretion. When the right amount has been hit, or you have a high blood glucose level, it will inhibit the secretion. A classic negative feedback system. Insulin decreases blood glucose concentration when it gets too high. Insulin aids glucose uptake by body cells where it can be used for energy. It causes the liver to form glycogen for glucose storage. Insulin may also promote amino acid uptake. So insulin is the opposite of glycogen. Blood glucose concentration controls secretion by negative feedback. That's what we've already said. So this, you should remember this. Low blood glucose inhibits secretion. High blood glucose stimulates secretion. So you should know when insulin will be produced or when glycogen will be produced, and what the effect is going to be. How are they regulating? What are they doing? What are they changing in the body? Some disorders, if you have a problem with insulin, you probably know some of this. You could have diabetes mellitus. It is caused by hyposecretion of insulin, not enough. Symptoms include high blood glucose levels and acidosis due to the use of fats for energy. And there are 2 types of diabetes, 1 and 2. Type 1, or insulin-dependent diabetes, appears in persons below 20 years and lasts a lifetime. Insulin injections are usually required at regular intervals. Type 2, or non-insulin dependent diabetes, appears later in life, usually over 40, and is most often in obese individuals. And it usually can be controlled by diet modification and medication. Hypoglycemia is due to excess insulin production causing excessively low blood glucose levels. The symptoms may include acute fatigue, weakness, increased irritability, restlessness, or even an insulin-triggered coma. Then we have the gonads. The gonads are the sex glands. Females have ovaries, which produce ova and sex hormones, and males have testes, and they produce sperm and sex hormones. Female hormones. Females have ovaries. They are located in the pelvic cavity. They are small and almond shaped. They activate at puberty in response to FSH and LH. And these two hormones, which I've mentioned before, FSH and LH, interact in a 28-day ovarian cycle. This is what the rise and fall of these two hormones dictate a woman's menstrual cycle. Estrogens are primarily female sex hormones. They are secreted by developing ovarian follicles, and their functions are the development and maturation of female sex organs, secondary sex characteristics, and they help maintain the uterine lining during pregnancy. Progesterone is secreted by an empty follicle after ovulation, and it functions to prepare the uterus for receiving an embryo. It maintains pregnancy, and it prepares mammary glands for milk production. Then we have the male hormone, and we have the testes, which are a paired ovid organ located in the scrotum. Interstitial cells secrete testosterone. Testosterone is the male sex hormone, and it functions in the development and maturation of male sex organs, secondary sex characteristics, and the male sex drive. There are some other endocrine glands and tissues that I'm going to mention here that also can secrete hormones. The pineal gland, the thymus gland, and there are some small glands of the stomach and small intestine, and the placenta. The pineal gland is a small cone-shaped gland within the brain, and it secretes melatonin. Sometimes we refer to it as our third eye. It's kind of right in the middle of your forehead. Melatonin functions with our sleeping and wake cycles. It controls the onset of puberty by controlling gonadotrophic hormones, and it regulates our wake-sleep cycles, and it makes our body sleepy. When exposed to light, production is reduced, and at night, melatonin production is increased. Some people take melatonin to go to sleep. It's more natural than some sleeping pills, so you maybe have heard of the term melatonin, and this is what it deals with. It is a hormone that regulates our sleep and our wake cycles. We have a thymus gland, which is located in the mediastinum, which is basically the center of our chest. It is large in infants, but it basically gets smaller with age, and it plays a crucial role in the development of our immune systems, immunity. It produces thymosin, which aids T lymphocyte maturation. T lymphocytes deal with our immune system, hence why this deals with our immunity. So thymosin deals with T lymphocytes, which is part of our immune system. And that concludes the lecture on endocrine glands, the other endocrine glands that we needed to cover. I hope you enjoyed it.